Hi, my name is Echo Nunley, and I am a nursing student at St. Elizabeth's Nursing School, and I'm making a video over continuous glucose monitors. If you're a new diabetic, this is a great way to track your sugars without having to prick your finger continuously. A continuous glucose monitor is a device that gets put on pinchable parts of your body, like the back of the arm or in the abdomen, and will continuously monitor your blood sugars night and day for 7 to 14 days. It does this by having a sensor being placed within the skin tissue, and it tracks the sugar in the interstitial fluid of your skin, and it wirelessly, like Bluetooth, goes into your phone through an app, so you can see what your sugar is in real time continuously throughout the whole day. It's a great option for those people who don't want to prick their fingers all the time, or maybe they forget, or maybe you're busy, like you have kids or a job or what have you that takes your time. This is a great way to, instead of having to take time out of your day to prick your finger and read it, it's just there on your phone. Technology is great nowadays. The way you'll want to put a continuous glucose monitor on is you'll want to wash your hands first, wash the area that you're about to place the monitor on, and then reach around and pinch part of your skin, and then you would place it firmly until you hear it click. That's how you know it's inside of your body. The sensor is inside your body. It shouldn't hurt too much. It shouldn't feel any different than getting your finger pricked, but make sure you're still practicing washing your hands and stuff like that before you do it, for in case you don't want to get infection within your body by doing that. From there, the sensor that's placed inside the skin will read your sugars, and it should alert you if your sugars are too high or too low on your app through a notification onto your phone. So in order to be able to effectively be able to use one, you'll need to know how to navigate your phone and how to download apps. You'll have to have some kind of cell phone and a carrier, and you'll have to be able to connect with Wi-Fi, because I'm sure that this uses Wi-Fi. Outside of that, though, anyone can have these, children, adults, older adults, as long as someone's there to manage the device itself and manage the cell phone within the app. Anyone who has type 1 or type 2 diabetes can have this device. In fact, I would probably recommend it. I think it's a lot easier than trying to prick your finger. The blood sugars can be a little delayed, but not by very much, which is something I think people should know. This is a great piece of technology that's come across for patients that have type 1, type 2 diabetes, especially because diabetes in itself can be extremely overwhelming, and having something that can track your sugars well continuously without having to think about it for a week is revolutionary, I would say. Questions or comments, I would definitely recommend seeing your doctor. If it's not reading right, I would see your doctor or call your doctor at least. I would have a backup, and if you think it's not correct, I would back up your sugar and make sure that if it is off, you need to contact your provider right away and make sure that it's recalibrated or if it's the right thing for you. Other than that, I haven't got much else to say about it. I think it's a great thing, and thanks for listening to me talk.